billion globally, and in Africa, $1.3 billion in the next 3 years. The 60% of it is support to the remuneration. And in addition, we have been supporting 16 African countries to work on the strategic planning of the workforce, shifting from specific vertical health workforce support to more comprehensive integrated health workforce development focused on the primary health care. And the Global Fund also finds a lot in the community health workers. Half of the human resource for investment from the Global Fund is to the community health workers. And we are doing more and better in CHW's investment, supporting the improvement of the system's maturity for the community health workers so that the CHW can be remunerated quickly. We are supporting innovative from one of in-service training, non-accredited, to long-term development of the workforce and also the quality improvement. For example, through the digitization, rationalization, and accreditation training. And those global fund in improving health investments in the recent couple. But we can do more and better. And we are in the large amount of investments together with the countries. We are proud to have supported the development of the Health Workforce Charter. I'm even more proud to be part of the signatories. We will continue and do more and better to align on the 5 key principles of the Charter. Be leadership at the center in the sustainable finance for the health workforce in the continent. Congratulations again for the launch of the Charter, and thank you very much.
Thank you very much, Dr. Mabuchi. Words are much appreciated. We're moving straight into the next final goodwill message from a key partner this morning. Before I introduce her, let me make use of this opportunity just to apologize that unfortunately Dr. Bekele will not be with us for this morning. Therefore, we will not have that goodwill message. So allow me to introduce to you somebody who is a leader and champion for driving change in global health, and she is no other than Ms. Diana Freimus, who is the Global Health Workforce Coordinator from USAID. Good morning.
Good morning. Honorable Minister Dr. Kukurongiwa Matila, Honorable Minister Dr. Shangula, Executive Director Mr. Nangombe, Dr. Moedi, and colleagues Joe, thank you for welcoming us here in Namibia to convene an advanced dialogue for the health agenda in the continent put forward by the Health Workforce Investment Charter. Globally, we remain in a pivotal moment where there is global recognition that investing in health workers is foundational, not only for reclaiming lost gains in health from the COVID-19 pandemic, but also for advancing strengthening health systems so that they are more resilient in both times of crises and not. Health and care workers need safe, healthy, supportive working environments to do their job. Yet we know that across the globe, health workers have to work in increasingly difficult, even dangerous, with inadequate rights and protections from under-remuneration, inadequate safeguards, equipment, and lack of access to mental health and psychosocial supportive services, to in many cases facing harassment and violence, with a rise of attacks being seen across the globe. These challenges have a disproportionate impact on women, who represent 70% of the health workforce, further hampering women's economic security. Global data shows inconsistency in labor protections for health workers, including for the community health workforce, underscoring the importance of advancing national policy environments to support health workers to keep them retained and working. The U.S. government, via PEPFAR, USAID, and other agencies, has long invested in the health workforce through its global health programs, recognizing health workers as critical to our successes, greater urgency to global regional health workforce shortages. The Biden administration launched the Global Health Workforce Initiative in 2022. The Global Health Workforce Initiative sets priorities for going beyond our routine U.S. government investments and having more intentional focus on how to better support and protect health workers with more equitable employment and equipping health workers with use of innovative technologies. At the U.S.-Africa Leaders Summit in December 2022, the U.S. government announced its commitment through the Health Workforce Initiative to align investments with country needs and to work strategically in coordination with African partners, including the WHO Regional Office for Africa, the Africa Union, and the Africa Centers for Disease Control and Prevention, to reduce health workforce gaps across the continent. There is zero doubt for us as we work to reduce inequities in life expectancy and increase access to quality health care through a global health system that health workers, particularly those delivering primary health care, are foundation to achieving our goals. And at USAID, primary health care is the majority of services through our global health programs and initiatives where they come together, which has been a key focus of our health workforce efforts since the launch of the Global Health Workforce Initiative. Further, our role at USAID isn't just to deliver our assistance, but to work with partner countries and other donors to better align and in support of country priorities and to optimize our resources. We recognize the importance of advancing dialogue to guide investment and enabling national policy environments that support health workers, and look forward to the discussion over the next 3 years. And the U.S. government will continue to be a partner in Namibia and across the continent as we work to ensure that health is accessible for all.
Thank you very much, Madame Primos. As I said, partnerships are important. We all know if you want to go fast, you go alone. If you want to go far, we go together. And I think that was the spirit of the messages we've just listened to. We are now going to listen to another presentation, a short speech, this time by somebody who a gentleman committed to the advancement of a new deal for Africa. That's from the CDC specifically in terms of health security. So ladies and gentlemen, I am delighted and honored to introduce you an accomplished medical, the senior technical advisor, a compassionate humanitarian with over 20 years of experience in public health care. That is no other than Dr. Jean Kaseya. Good morning, Doctor, and welcome to this podium.
It's not like that, huh? Thank you. My Honorable Dr. Sarah Kugungwela, Prime Minister of Namibia. Honorable Shangu, Minister of Health, Namibia, and all ministers present here. My sister, Dr. Mweke, different colleagues, experts from African Union member states, dear colleagues and friends. For those who know my past, they know that Namibia is my second home. I love this country, and I feel home when I'm here. I want to invite all of you to do like others did yesterday. Please go to some kapaz. And dear colleagues, please thank the government of Namibia for hosting this important forum. It's with both honor and privilege to stand here before you today at the outset of the Africa Health Workforce Investment Forum. This gathering under the esteemed auspices of the WHO marks a pivotal moment of our collective effort to strengthen the health systems across the African continent through strategic investment in our health workforce. Please let me thank you for organizing this important event. Let me particularly thank my sister, Dr. Mwiti. She's not just a partner for us, but she's a big sister. She instructed me to be here. She knew about me. I have been today for the opening ceremony of the Global Solutions, and I was expected to be tomorrow in Denmark. She instructed me to be here today. And then you made my team in a very difficult situation, but I'm here. This is why I will apologize. I will leave Namibia today to fly to Berlin. I want to be in Berlin, I will be in Denmark, and then on the 9th of because of meeting President Ruto. Honorable and dear colleagues, they are currently negotiating in Geneva the pandemic agreement. Because health workforce is essential for pandemic preparedness, prevention, and response, there is a substantive article called related to the pandemic health workforce. Please allow me to read the paragraph 1 of this Article 7. Each party, in line with its respective capacities and national consensus, shall take the necessary steps to establish, safeguard, protect, invest in, and sustain a multidisciplinary, skilled, trained, and diverse workforce to prepare for, and respond to emergencies, and will be a member state charter for this agreement. Make sure that this agenda. The statistics speak volumes. While Sub-Saharan Africa accounts for approximately 24% of global disease burden, it is home to only 3% of the additional 1.8 million health workers in Africa alone. This will be worse the recurrent health that we are facing on a daily basis. Let me remind you, in 2023 alone, 166 hours, and the is not good. Eight states are realized in the 2017 African Union Assembly decision that called for recruitment, training, and deployment of 2 to accelerate this agenda. We thank our head of state who approved during 2020 President champion work partner we can that colleagues to what from before the farm and the health sector are 45% of GDP of Switzerland and India between 2010 and 2020. Can you say the same in your country? This is the narrative we need to change. Because in these countries, Ministers of Health become key partner of Ministers of Finance. They are not no longer there. Now, honorables, colleagues, you will understand why every day I have to qualify the local manufacturing agenda in Africa as the second independence of Africa. Because it will bring health security, job creation, economic growth, peace, and stability. Last week, I was so upset about an article from the UK newspaper called the Telegraph, and maybe some of you saw it. This article is stating that local manufacturing in Africa is a dead win. And they are advising that Africa has just to accept that India is the pharmacy of the world, and Africa must strengthen its ties with this country to import more needed vaccines and medicines. To support this conclusion, they are outlining three major challenges. The first one, low human capacity. The second one, low ability to develop antigens for vaccines. And the third one, inability to procure vaccines made in Africa based on economy of scale. The first challenge they are outlining is why we are meeting today here. While we made huge progress, because no one can convince me that we didn't make progress in this area, this gathering will send a strong message about our firm commitment to address the health workforce issue by becoming more innovative. The second challenge that they are highlighting is why we are fighting with this pandemic agreement to have more transfer of technology. Please let us also recognize that we made huge progress, and now Africa is capturing more funding for resource for clinical trials and research and development. And this is also one of the reasons I will be in Denmark, because I'm meeting with Wellcome Trust and Gates Foundation to announce a big investment in Africa in terms of state, and they approved that the creation of the continental pooled procurement mechanism That one is a game changer. No one can come and convince us that we don't have market in Africa. We are talking about 1.4 billion people. We are talking about the market that will be the biggest one in a few years. But we need to be strategic. This is why. We managed to discuss with UNICEF. And currently UNICEF is transferring to Africa CDC all of their capacities and capabilities on pool procurement and supply chain management. To cut the story short, in the next 2-3 years, Africa CDC will start to play the role that UNICEF is playing for African countries in terms of procurement and supply of commodities. With all of that, who are people, intelligent people in this room, who can convince me that we need to follow the advice from the telephone? I don't see any. This week, Africa CDC will release a response to this article because we find it as an insult to our continent. For the time I will be leading Africa CDC, I will never accept this nonsense and paternalism that characterize for a very long time our relationship with some of our partners. Therefore, I will need your full support, ministers, colleagues, partners, because some of our African brothers and sisters could be easily manipulated by some of these people to destroy the vision of local manufacturing. Honorables and dear colleagues, 2 weeks ago, I was in Washington for the World Bank and IMF Spring meeting. Among gatherings, I had an impressive meeting with the ministers of finance from Egypt, Tanzania, and Ghana, Central African Republic. We agreed with me to work together and to change this narrative, to make the health sector an asset. Thanks to the experience of innovative financing that we managed to put in place in Egypt, and that is generating around $2 billion per year for the health sector in Egypt, we agreed with the Minister of Egypt to appoint him to become the lead of the African high-level panel on innovative financing in the health area. He will be joined by 3 other ministers of finance, 3 other ministers of health, and some partners and high-level personalities. Very soon you'll be updated on this initiative. To bridge the gap between finance and health, I also initiated a continental platform to exchange on health financing and to bring together every year during the spring meeting in Washington, Minister of Finance, Planning, Budget, and Health. That one will be the game changer to discuss the domestic financing and to discuss also, because I already engaged the President of World Bank, Peterson from Global Fund, Sanya from Gavi, and a number of other partners. That one will become the platform for us also to make them accountable on how they are financing health in Africa. Honorables and dear colleagues, as demonstrated, we'll go nowhere if we don't have appropriate health workforce in Africa. At continental level, our countries have adopted the AU Agenda 2063, the Africa Report. To achieve this ambitious agenda, we have a milestone, that is the SDG, especially SDG 3 for us. We'll never achieve the SDG 3 if we don't achieve the universal health coverage. How can we achieve all of that if we are still facing a serious shortage of health workers in Africa that is undermining access to quality health services to our populations? Although there have been some strides towards establishing a resilient and robust healthcare system in some African countries, substantial progress is lacking in terms of ensuring an adequate and fair distribution of healthcare workers regionally and nationally. The public health workforce shortage in Africa is based on several factors, including underfunding of health system by member states, inadequate training capacity, poor remuneration of health workers, rapid population growth, international unchecked labor migration, weak governance of the health workforce, lack of career path, as well as poor retention of health costs. Today, this forum brings us together not just to discuss, but act. Over the next few days, we will delve into a series of crucial topics like innovative financing models that we need to bring, policy and planning, what frameworks can be established to support sustainable health workforce, retention strategies, technology advancement, and we are not talking more about the involvement of private sector. These discussions are not academic. They are urgent and they are essential. Our collective effort is needed to translate our plans into tangible outcomes. Ladies and gentlemen, as we set our sights on the ambitious goals, let us remember the power of partnership. The forum is also a testament, as two colleagues they made it, that we can achieve a lot together. It is a space where government, global and regional, engagement and commitment are a clear signal for innovative solutions, and will champion the kind of transformative agenda that will not only improve health outcomes, but will also stimulate economic growth and stability across Africa. In conclusion, as we move forward with our sessions today, please let us challenge ourselves to think beyond the conventional. Let us commit to action that is bold and to strategies that are inclusive. Please let us harness our collective energies to build health systems that are not only equipped to meet current standards, but are resilient enough to adapt to future challenges. Therefore, Africa CDC is proud to be part of the launching of the Africa Health Workforce Investment Chapter. It is my hope that this will mobilize and sustain political and financial commitment. There is no doubt for that because the Prime Minister is with us today. I want to thank you once again for your dedication to this cause. Let us make history together by building a healthier and a stronger Africa. I thank you.
The clarion call has been made. It's for us to respond to it as we engage, and as His Excellency said, bold and inclusive engagement. Your Excellency, your passion speaks volumes, so as a Namibian, I must say I am so encouraged to listen to you, and you've said something of this in my heart. So thank you very much for the delivery of that speech. We are now going to have another bold African speak to us, and she is the Director General, obviously, of the WHO, Dr. Moeti. And Dr. Moeti, upon researching, for the purpose of introducing you this morning, I was delighted to read how you stumbled into public health almost. You tell stories, as I read about you, the combination of your father's work and the impact he's had upon where you are today. And interestingly enough, one of the examples she uses is just driving around with her father as he goes around his business, and the circumstances and the impact that that has made upon her as a small child. Professional to take us into a deep dive this morning, and that dive will help us to understand the health workforce in the WHO Africa region, program that is policy reform investment. As she comes to address us, Dr. Hill.
Thank you, Madam Moderator, for reminding me that my attempt to rebel and not join my father's profession changed because he inspired me so much as a public health worker. The Right Honourable Dr. Sarah Kugongwela Amadila, the Prime Minister of the Republic of Namibia, Honourable Dr. Kalumbi Shangula, Minister of Health and Social Services of Namibia, and dear Honourable Ministers, Deputy Ministers of Member States of different African member countries, my brother Dr. Jean Kaseya, Director General of the Africa CDC, thank you so much for your passion and your inspiration. Dr. Shunkushe Mabuchi, Director of Resilient and Sustainable Health Systems Strengthening in the Global Fund, and Ms. Diana Frimas, Global Health Workforce Coordinator of USAID. All Member States representatives and guests, esteemed partners and colleagues, distinguished ladies and gentlemen, a very good morning to you all. First and foremost, I'd like to once again, as a child from a neighboring country, express my sincere condolences to the government and people of Namibia on the tragic passing of His Excellency Dr. Hage Godfrey Geingob, the previous president. Honourable Minister, Honourable Prime Minister, despite the difficult period of mourning that I know the country is going through, thank you for having continued to agree to host this meeting. We very much appreciate that from WHO. Right Honourable Prime Minister, distinguished ladies and gentlemen and colleagues, our gathering today is a clear sign of our commitment to addressing the people's right to and yearning for access to skilled health workers who are equipped and supported to prevent and manage disease and to promote wellness. The theme for this forum is aligning and stimulating investments to address health workforce challenges in Africa. It provides an excellent opportunity for decision makers, yourselves gathered here, to discuss and adopt appropriate solutions for addressing health workforce challenges in our countries in the region. And I think quite a lot has already been said about how they manifest and some suggestions as to how we must go about handling them. Our theme, therefore, underscores the importance of strategic investments and aligning efforts to overcome these challenges. We trust that this renewed commitment will accelerate progress to equitable access to a fit-for-purpose health workforce in Africa. Based on our experience from the COVID-19 pandemic, ensuring that healthy people are protected from catastrophic public health emergencies is intricately linked to equitable access to health workers within resilient health systems. That is why we've been very engaged together with the Africa CDC in supporting our member states in the ongoing global discussions on pandemic preparedness and all related investments and agreements at the international level. Health workers must be empowered to provide essential services at all times, including during emergencies. They need to be ready to be able to prevent, to predict, and to promptly detect and effectively respond to public health emergencies. As WHO, we've repositioned ourselves to maximize the impact of our work in countries. As you may know, for the last 10 years, we've pursued a far-reaching transformation agenda focused on delivering measurable impact in countries and establishing new ways of serving the people. This includes improving our working modalities with partners. When I was elected for my first mandate as WHO Regional Director for Africa, I was acutely aware of the fundamental need to strengthen our country-focused approach, especially on the health workforce. I thus established a dedicated technical team focusing on the health workforce in our regional office. And in 2017, we tabled before the Ministers of Health a framework for implementing the Global Strategy on Human Resources for Health, or the Health Workforce 2030. This was adopted at the 67th session of the Regional Committee for Africa, that is the annual meeting of health ministers. The framework aimed at reducing inequalities in access to health workers by 50% by 2030. In collaboration with various partners, we support countries in making significant policy reforms and smarter investments to strengthen their health workforce. In the past, our collective effort over the last decade has yielded some results. And in some areas, I'll say that there are remarkable gains. In the past years, WHO has invested in supporting countries to better track, understand, and manage their health workforce. More countries now have clear national strategies that outline their policy priorities and commitments. Without these, it's difficult to start any action. We've invested significantly in working with countries as well to understand their health workforce situation and invest in training and management of health workers based on evidence. For example, countries in the region can now track and report on 80% of different health workforce occupations, doctors, nurses, dentists, and others, compared to less than 30% in 2023. We regard that as significant progress. Between 2018 and 2022, evidence-based national health workforce strategies increased by almost half, from 27 to 39 countries. And since 2017, we've supported 22 countries in conducting health labor market analysis. These analyses have impacted on policy reforms, stimulated job creation for health workers, and unlocked the investments of both governments and partners. With our technical advice, countries have invested in expanding the training of healthcare workers, and the capacity to train has increased by 70% from about 150,000 graduates in 2018 to more than 255,000 in 2022. And I'd like to emphasize that the private sector contributes at least 40% of this capacity, and just echo that partnership with the private sector is extremely important. The yearly increase in the number of health workers trained has tripled the region's headcount from 1.6 million in 2013 to 5.1 million in 2022, and this includes about 850,000 community health workers. So I think it's very important to reflect on the progress, the investments that have been made, and be encouraged by them for the work that we have to do going forward into the futures. And we're not just training health workers, but we're also paying attention to quality assurance mechanisms. For example, accreditation procedures for health training institutions have been established and strengthened in 32 countries. And countries are also progressively implementing competency-based health worker education curricula, with about 30 out of our 47 countries implementing the WHO prototype curriculum for nursing, midwifery, and for eye health. We know that the improved health workforce availability has directly contributed to improvements in the region's Universal Health Coverage Service Index, which rose from 36 in 2010 and to 48 in 2021, so out of 100. So I'd like to start by saying we have made some investments, we are seeing some improvements, but we clearly have a lot still to do. Ensuring the efficient use of the health resources is important in making sure that every single dollar counts in making a difference in the lives of the population. And in the African region, for every $5 spent on health, $1 is lost due to technical inefficiencies. These include the existence of ghost workers who remain on our payrolls, absenteeism, and suboptimal performance, just to mention a few. And another example that we might mention is the way that we carry out training, in-service training. And one of the things that we need to do is transform that so that it's more efficient. However, we also have to acknowledge that there's been a 13% improvement in health systems efficiency in the past 5 years. So some progress is being made, and part of what we are going to be discussing here is how to accelerate and to expand that. Right Honorable Prime Minister, ladies and gentlemen, as I've said, despite these results, persisting and emerging challenges still exist, and allow me please to highlight 5 of them. First, as has already been mentioned by previous speakers, the African region still has the lowest health workforce density compared to other regions worldwide. Our new analysis suggests that the African region will face a shortage of 6.1 million health workers by 2030, as already been said, if we continue with business as usual. This will greatly affect our pace in tackling the disease burden with effective service interventions across health promotion, which is a very important role of health workers, disease prevention, treatment, rehabilitation, and palliation. Of the anticipated shortage, about 5.3 million of these health workers will be doctors, nurses, midwives, pharmacists, and dentists. And then secondly, we see a paradox where, despite the shortage, the investment in health worker employment is not keeping pace with the output from our training. And almost 27% of trained health workers failed to find jobs. So governments would need to increase their current funding levels by 43% to be able to absorb all the trained health workforce in decent employment. And I'd like to emphasize decent employment, meaning earning a living wage in conditions of work that enable them to live good, satisfactory lives. Third, inadequate remuneration and deficits in decent working conditions, as I said, remain critical. Every year between 2018 and 2022, 14 countries have reported having experienced an average of 4 health worker industrial unrest episodes or strikes. I can only imagine the challenges for ministers of health and other authorities in managing our workforce under those circumstances and continuing to provide the services that the population needs. Fourthly, with 82% of the African health workforce young, we are a young continent, meaning aged 45 years or younger, and mobile. Difficulties in finding jobs and deficits in their working conditions are pushing them to look for jobs in other countries, that is, to migrate. Along with an increased demand for health workers in high-income countries, we are witnessing record levels of international mobility among our health workers. So for every 10 doctors or nurses working in the African region, for example, 1 other is in another country. Recent evidence reveals that as much as 42%, that is almost half, of healthcare workers have future intentions to migrate. This has translated into record levels of health worker resignations and job abandonments in several countries. We have to acknowledge and recognize that the economic cost is enormous for our countries. For every doctor who emigrates from Africa, the country loses an estimated $1.85 million in returns from their investment. And for every nurse who immigrates, this loss is at about $1.21 million. These lost investments far outweigh the remittances accrued to the source countries. So we must find pragmatic ways to address this challenging and sometimes paradoxical situation of resource transfer to benefit both the source and the destination countries. Fifth, regarding gender. Women account for 72% of the health workforce in the region. However, they are concentrated among community health workers, midwives, and nurses. Still, women occupy only 1 in 4 top healthcare leadership positions and earn 20% less than their male counterparts. And we can add to this the informal caring role that women play in the household, which is uncounted and unremunerated. So this really highlights the need to address inequities and eliminate gender-based discrimination in earnings and go for gender equity, even as we work towards improving our human resource situation for health on the continent. There can be no overstating that quality health care requires investment in health workers, in medicines, in infrastructure, among others. And we must see it, as was eloquently said by my brother Jean Kaseya, as an investment to be nurtured, not as a cost to be contained, which used to be the attitude in the past. I'm very happy to say my view is that our African leadership has recognized that this investment is worthwhile in our countries. We must therefore continue to deepen our collaboration with other sectors, particularly, of course, the Ministers of Finance, Ministries of Labor, Ministries of Education, and very much with the private sector. So I'd like to take this opportunity to thank the ministers and senior government representatives that have joined us in this forum from these sectors outside of health. Your role in our collective ambition is absolutely crucial. All these sectors need to incorporate the health sector workforce priorities into their sectoral plans and join the health sector in developing a national health workforce investment compact to firmly outline the commitments of governments of partners. So looking into the next half of the Sustainable Development Goal era, 4 issues require accelerated investments and policy reforms. We need to expand our health worker training by 8 to 12% annually to meet the health needs of our populations, first and foremost. In addition to that, we need to transform the health profession education curricula to be competency-based and fit for purpose to tackle the health-related challenges of our time today, both during peacetime and during emergencies. And beyond technical skills, it should also emphasize digital skills. We are in an age when digital technology is a massive opportunity for training, for transforming training of healthcare workers. People-centered interpersonal skills with a depth of socio-cultural competence. We also need to progressively integrate community health workers into the public health workforce through standardized competency-based training, clear selection criteria with job descriptions, and providing commensurate compensations and career progression. We need to increase opportunities to employ and retain trained health workers, especially in rural and at primary health care settings, while ensuring decent working conditions and protection. And we know that these proposals are not cost neutral. They require capital and operational investments, leveraging government, leveraging the private sector, and external funding resources. Looking into the next half of the SDG era, we must invest smarter in the health workforce. And how we can do it has been carefully developed through consultations and put together as the Africa Health Workforce Investment Charter, which we will discuss and launch in the subsequent sessions of this forum. We convened a policy dialogue with our member states and partners, where this idea was conceived and a WHO expert group developed the first draft. We subsequently have held consultations with member states, with partners, and with the public to get us to where we are today. Since the Charter was developed, some early adopter countries have started using the principles to guide policy reforms and investments, showing very promising results. For example, Zimbabwe used the Charter to develop its Workforce Investment Compact to align the government and partners and stimulate over $200 million in investments in the next 3 years. Currently, we as WHO and partners support 5 early adopter countries to use contextually generated evidence for national policy dialogues. They'll also use this data to develop and sign health workforce investment compacts between governments and partners and align their efforts to stimulate policy, action and investments, because it's extremely important that all the contributors to developing the health workforce work together coherently and efficiently within countries. In partnership with the Global Fund, with the ILO, OECD, WHO, Working for Health, Multi-Partner Trust Fund, we are providing financial and technical assistance to 10 countries in using the health labor market analysis to inform policy reforms and investments. So the principles of the Charter underpin this work. To conclude, I'd like to recommend that we do the following. First, let's prioritize investments in health workers, the backbone of every health system. It has already been eloquently said. Let's invest in their education, their employment, decent working conditions, and retention. Secondly, let's work with our bilateral and multilateral partners to strengthen the alignment of our investments with jointly identified government priorities to amplify our impact together. Thirdly, it's important to see health not as a cost to contain, but as an investment to be nurtured, an investment in sustainable development and our collective future for a healthier, safer, more inventive and fairer Africa. With a young population that we have, if they are healthy and educated, I think this continent could lead the world. We have that potential. Our collective efforts are crucial to addressing the challenges that we have outlined, and each of us can contribute to solutions by using our different comparative advantages. For some, this will be using training. For others, it will be through employment and retention, regulation, and other aspects. So we're very excited as WHO to have had you gather here today to discuss and agree on the Africa Health Workforce Investment Charter. And we look forward to agreeing together, and we look forward to working with you as we help our member states work with partners at the local level, develop their compacts, and develop the human resources for health that the people of this continent need and deserve. Thank you very much.
Thank you very much, Dr. Mweti. Not a cost to be contained, but an investment to be nurtured. Those are the words of Dr. Mweti at the occasion of the Africa Health Workforce Investment Forum opening speech. We're now going to have a little bit of a musical break. We do want to let those of you who are not from Namibia know we can also sing in this country. Otherwise, we don't want you to go home with the impression that Namibians just speak and they are nice, but we can also sing. We have some music in our veins. So I'd like to call on the UNAM Choir, and UNAM is the University of Namibia, and they are an award-winning choir. These are students from that specific university, and they will be entertaining us for the next 5 minutes or so, and then I'll invite the Honourable Minister of Health and Social Services to come and do his address, after which the Prime Minister will then also speak. So UNAM, I'm sure you're ready. So thrilling to be here and to listen to those voices. Dr. Moeti, it sounded like you were home, right? Very much so. I could see on your face that you were feeling the music. I looked at the number of you also in the audience and I could see how much you were enjoying it. So thank you very much again to the University of Namibia Choir. If you would just give them a final round of applause, please. And now I'm delighted to introduce to you, as Namibians say, a son of the Namibian soil. That is no other, ladies and gentlemen, than the Honourable Minister of Health and Social Services. But so that you can know that I prepared for this engagement, I have to tell you a little bit of a story about him. So that don't just say the Minister of Health and Social Services and you think, why did they bring this girl here, you know? So let me show that I've prepared. I tried to research Dr. Shangula. I tried to ask ChatGPT who you are. And they had 2 sentences, 2 to 3 sentences of who Dr. Shangula is. So I thought, let me just depend on old ways of introducing people, you know, this we can depend on. And so, ladies and gentlemen, it gives me great honor this morning to introduce to you our speaker, our next speaker, Dr. Shangula, who is a medical doctor, as I'm sure you know, a public health practitioner. I'm not sure that you knew this, that he is also a businessman, not currently, had been in his career, you know, and that he also is one of the leaders who really helped to get Namibia to the place that we are in terms of our independence struggle. He holds his medical degree from Moscow, a university there in Russia, the Russian Federation, master's degree in public health from a university in the United Kingdom, from the University of Public Health in London, as well as a business degree, Masters of Business Administration from Maastricht in the Netherlands. After qualifying as a medical doctor, he returned to the military operation. That's during our years of the liberation struggle, and he served specifically there. I see him moving because I think he wants me to rather go to the ChatGPT way of introduction, which was, like I said, the shorter one. So we know who this gentleman is who's standing in front of us. He is a very competent, very compassionate Namibian, has written many articles. But Dr. Shangula, I just want to read for them the benefit of what ChatGPT says who you are. ChatGPT says the following. I asked, who is Kalumbi Shangula? This is what they said. Dr. Kalumbi Shangula is a Namibian politician and medical doctor who has served as the Minister of Health and Social Services in Namibia. He's been involved in various public health initiatives and policies within the country. I think we all agree. And on that note, I'd like to ask you please to warmly applaud as he comes to make his address. Dr. Shangula.
Thank you very much, Director of Ceremonies, Ms. Hilda Amjebo, for giving me the floor. And I also acknowledge your co-director, Mr. Ben Nangumbe, the Executive Director of the Ministry of Health and Social Services. All right, Honorable Prime Minister Dr. Sarah Kuwongera, the Prime Minister of the Republic of Namibia, Honorable Ministers, my colleagues, and Deputy Ministers, at this juncture, I am tempted also to ask the Deputy Minister of Health and Social Services of Namibia to stand up so that you can recognize her, and if there is anything you may do. Members of the high table, Dr. Matshidiso Moeti, WHO Regional Director for Africa, Dr. Jean Kaseya, Director General of the Africa CDC. I just wanted to welcome back, by the way, welcome back to Namibia. And since you said that you are going to go today, please remember to pass at Katutura for a kapana, even on a takeaway basis. And while we were sitting there chatting and listening to the statement, he also advised that I advise you, before you leave, to visit Katutura for a kapana. It is unique for Namibia. Nowhere else you will find that one. Ms. Diana Fleermeis from the Global Health Workforce Coordinator, USAID, Dr. Makubi, Director of Resilient and Sustainable Health Systems Strengthening from the Global Fund. Esteemed invited guests, let me write on the protocol as established by the Director of Proceedings and acknowledge you all in the interest of time. I am honored to be accorded the opportunity to address this diverse gathering of esteemed partners in health as this inaugural WHO Africa Health Workforce Investment Forum. We are grateful that the WHO chose Namibia to host this historic event. I welcome all dignitaries from different countries and organizations. Your presence here signifies the importance you attach to the subject matter of this inaugural forum, namely the necessary investment in human resource for health in Africa. According to a study commissioned by the World Health Organization, the African region has a ratio of 1.55 health workers per 1,000 population, which is disconcertingly low, below the WHO threshold of 4.45 health workers per 1,000 population needed to deliver essential health services and achieve universal health coverage. This serious shortage of health workers in Africa undermines and undercuts access to and provision of health services on the continent. This is despite the fact that some countries in the region have made commendable and exemplary efforts to bolster the health workforce domestically. Africa faces numerous health workforce challenges, ranging from shortage of trained professionals to issues of retention and distribution. Many healthcare workers experience burnout due to long working hours and the sheer disproportionate number of patients and clients they must attend to in their daily work. These challenges make it difficult for public health systems on the continent to provide responsive, comprehensive and high-quality health care to all citizens, particularly in remote and underserved areas within the ethos of the universal health coverage. With respect to the shortage of trained health professionals, this matter is exacerbated by factors such as migration, inadequate training facilities, and limited resources for continuing education and professional development. Addressing this shortage requires a multifaceted approach, including investments in training programs, incentives for health workers to remain in their home countries, and initiatives to attract African professionals in the diaspora back to the continent. The number of Africans who have left the continent in search of greener pasture in other parts of the world are staggering. It is a matter that needs to be addressed as a top priority for African governments and indeed all those who wish to see a shift in the historical as well as current trend. In Namibia, the public health system continues to face increased human resource for health demands. The government of Namibia recognized that having an adequate and equitably distributed functional health workforce is a prerequisite to achieve the health-related sustainable development goals. Against this backdrop, the Ministry of Health and Social Services of Namibia commissioned a situation analysis and health labor market projections to inform the development of a national human resource for health strategic plan. The plan is designed to guide health workforce interventions in support of the efforts to achieve our priorities articulated in the 5th National Development Plan, the 2nd Harare Prosperity Plan, and Vision 2030. The plan also takes into account the imperatives of the need to implement the goals and targets of the Sustainable Development Goals and the universal health coverage. The plan envisages that by 2030, Namibia will have a quality fit-for-purpose health workforce that is equitably distributed and efficiently utilized to address the health needs of the population towards the attainment of universal health coverage. In this pursuit, 4 strategic objectives with the corresponding sets of intervention have been adopted from the Global Strategy on Human Resource for Health, which are 1. To align health workforce production capacity and quality to match population health needs and economical demand. 2. To optimize health workforce recruitment, distribution, retention, and utilization in the public sector towards achieving universal health coverage. 3. To provide efficiency in health workforce management to catalyze health system performance. And finally, to increase investment in health workforce information and evidence generation for use in decision making. Namibia's Human Resource for Health Strategic Plan, covering the period 2017-2018 to 2019-2023, is an important planning tool for the country as it sheds light on human resource for health needs of the country for both the public and the private sectors. One of the tools provided for in the plan is the publication of the annual human resource status report for the country. It is against this backdrop that I'm delighted that Namibia is hosting this first ever Africa Health Workforce Investment Forum, a timely platform for stakeholders to engage on matters related to the health workforce agenda in Africa. We look forward to practical solutions emanating from this forum that will enable African governments and all stakeholders to mobilize and secure commitments, partnership and investments that are needed to tackle the health workforce challenges on the African continent. In these endeavors, our approaches should be guided by the principles and actions enshrined in the Africa Health Workforce Investment Charter, which will be launched during this meeting. I once again express our utmost gratitude to the World Health Organization and the organizing partners for this timely initiative, which has the potential to catalyze our collective efforts to achieve our shared goals aimed at achieving and engaging each other on the basis of sustainable development agenda of the world we share. Your Excellencies, distinguished ladies and gentlemen, once more, I join the Executive Director of the Ministry of Health and Social Services to welcome you to Namibia and wish you all fruitful deliberation. I thank you.
Thank you very much, Dr. Shangula. I frequently have to apologize for changes in the program, and I am always appreciative of the audience when they flow with us. So, Dr. Shangula, I was told by your ED, your Executive Director, who I must put on the spot now, and he said that you would be introducing the Right Honourable Prime Minister. So, if that is the agreement, still, then I'd like to call you back, please. Thank you for your speech, and also then ask you now if you would kindly introduce to us The keynote speaker for this morning, the Right Honourable Prime Minister of the Republic of Namibia, Dr. Sarah Amandila. Minister, the floor is yours again.
Thank you very much, Director of Proceedings. Indeed, I was aware that I was going to introduce the Right Honourable Prime Minister, but I wanted to take a short break before I do. Ladies and gentlemen, today's event marks significant progress in the history of public health in Africa and the world. The inaugural Africa Health Workforce Investment Forum is indeed an historic event. It creates a platform for partners in health to interrogate and critically look into the current and future health workforce needs for the continent. We must capitalize on this opportunity. At the same time, for Namibia, we are celebrating many years of hard work and steadfastness in the national response to HIV/AIDS. We are both humbled and encouraged by the recognition bequeathed on our country for the achievement recorded in the prevention of mother-to-child transmission and hepatitis B. In all areas of endeavor, we need resolute action and dedication. As it is often said, there are no shortcuts in life. We must do the work, we must put in efforts. This is what brought us here, celebrating and recognizing the country. I take this podium to introduce to you our keynote speaker for this event, the Right Honourable Prime Minister of the Republic of Namibia, Dr. Sarah Amandila. Dr. Amandila is a freedom fighter who joined Namibia's struggle for freedom and independence at a very tender age. She left Namibia to go into exile and completed her secondary school education in Sierra Leone before pursuing further education in Pennsylvania, United States of America, where she trained as an economist and obtained her master's degree, and also obtained her master's degree in economics at the London School of Economics. She's a distinguished diplomat, strategist, and a seasoned economist. For her dedication to civil service and accomplishment in leadership and change management, she was awarded a doctorate of philosophy honoris causa in public finance. After the attainment of Namibia's freedom and independence, the Right Honourable Dr. Sarah Amandila entered the political leadership at the tender age of 27, when she was appointed the Director General of the National Planning Commission at the cabinet level. In 2003, she was appointed and served as the Minister of Finance, where she became well known for her turnaround strategies for fiscal efficiencies and further saw Namibia's revenues booming with unprecedented budget surpluses. This laid a strong foundation for economic performance. In 2014, Dr. Amandila was conferred the Most Brilliant Order of the Sun, second class, for meritorious services. As head of the civil service, Dr. Amandila played a crucial role in the implementation of Namibia's strategy that successfully responded to COVID-19 pandemic, addressing the immediate health emergencies and spurring economic revival and protecting livelihoods. She is an advocate for gender equality, women empowerment, and public health. Ladies and gentlemen, we have amidst us a true champion for the strengthening of human resource for health in Africa. It is now my honor to call to the podium the Right Honourable Prime Minister of the Republic of Namibia, Dr. Sarah Amandila, to deliver the keynote address for this event. Right Honourable Prime Minister.
Thank you very much, Dr. Shangula, for that introduction. You may please take your seats. Co-directors of proceedings, the ED of the Ministry of Health and Social Services, and Ms. Hilda Namjembo, Honorable Dr. Kalumbi Shangula, Minister of Health and Social Services of Namibia, Honorable Ministers and Deputy Ministers present here, Permanent Secretaries and Executive Directors, Heads of UN agencies, the Director General of Africa CDC, WHO Regional Director for Africa, WHO Directors from Headquarters in African Region, WHO representatives, senior government officials, development cooperation partners, esteemed participants and delegates from WHO member states present, distinguished invited guests, members of the media, ladies and gentlemen, good morning. On behalf of His Excellency Dr. Nangolo Mbumba, President of the Republic of Namibia, I warmly welcome you to Namibia and thank the World Health Organization and Partners in Health for choosing Namibia as the host for this inaugural Africa Health Workforce Investment Forum. It is our privilege to host you in Windhoek. Allow me to take this opportunity to recognize and appreciate all health workers for their enormous sacrifices in helping us all attain the highest standards of health and well-being. It is still fresh in our minds how you sacrificed to get us out of the COVID-19 pandemic at a great cost to your own physical and mental health. This is why our late President, Dr. Hage Geingob, dedicated the commemoration of Heroes Day to frontline health workers for 2 consecutive years in 2020 and 2021. The African region has for long been confronted by a myriad of health challenges, ranging from maternal and neonatal mortality to the unrelenting burden of communicable and non-communicable diseases, malnutrition, and more recently, the surge in pandemics. Resilient and well-functioning health systems are critical to ensure the attainment of the UN Sustainable Development Goals, especially Goal 3 and other health-related SDGs. Equally important is the imperative of investments to strengthen the health system building blocks. One of the critical components is the availability of a well-resourced, capable workforce. Our continent, and indeed the global village, can only make progress collectively towards achieving the SDGs targets when individual countries are making progress at national level. At granular level, countries will only make progress when individual communities are making progress. Co-directors of ceremonies. In Namibia, we are committed to achieving the SDGs. We are taking steps to realize universal health coverage and build a resilient health system where everyone, everywhere in Namibia, can have access to the health services whenever they need them. At the center of this is a robust, well-resourced workforce. In this context, therefore, the deliberation at this forum to find better modalities for investment in the health workforce are both timely and relevant. Any discussion about the delivery of healthcare services must acknowledge that for these services to be rendered and rendered effectively, we need feet on the ground. We need the dedicated men and women who must put in the hours and the sweat to care, to treat and to manage patients and clients who present to health facilities. For the health professionals to do their work effectively, they must be well-resourced and capacitated in the best ways possible. It is thus important
to ensure that governments make the necessary investments, not only in the public health systems overall, but specific attention must be given to strengthening the health workforce. Without a well-resourced health workforce, there can be no effective and high-quality healthcare services. The question that we need to ask ourselves as government representatives and stakeholders is, what do we wish to see when we talk about investing in the health workforce? The answer to this question is as broad as the diversity in this room. The importance of investing in the health workforce is a matter that has been on the agenda of intergovernmental bodies, international organizations, and academia for many decades. The Abuja Treaty that obliges African governments to allocate not less than 15% of their budget to the health sector speaks to this matter. The World Health Assembly has also adopted resolutions dealing with this matter over the years. Academics have researched and written epistles on this very conundrum. There is a level of consensus that more investments are needed to strengthen the health workforce, taking into account a number of factors. It is true that in many African countries, healthcare workers face myriads of challenges. They have to work long hours, precipitating burnout. We saw this during the COVID-19 pandemic. Many of the physical facilities in which they work are aged, degrading the quality of services rendered. There is a lack of experienced professionals who render training to the younger cadres entering the different health disciplines. The remuneration packages in many public health services are not in a position to compete with the packages in the private sector. As a result, public health care services bleed heavily as professionals depart for the perceived greener pastures. On top of that, the perceived greener pastures are not at home. They are found thousands of miles on other continents. Hence, the phenomenon known as the brain drain, which has decimated public health care systems in many African countries. With these realities in mind, investments in the African health workforce must necessarily aim to address specific and contextual African challenges. Primarily, investments in the African health workforce must first and foremost aim at building capacity and skills, not only operational skills for those handling patients in wards of health facilities, but also skills to train, to teach, and to mentor. Skilled and capable healthcare professionals are what will make or break healthcare service delivery on our continent. Secondly, investments in the health workforce of Africa must aim to engender a sense and ethos of service and compassion. It is now more common than not to encounter patients who have experienced less than adequate services at the hands of some healthcare workers. There is a need, therefore, to promote greater motivation and sense of duty in our healthcare workers. Investment in the health workforce requires that healthcare workers are provided with the tools of the trade, the equipment, and a conducive environment to effectively carry out their duties at all times. Not doing so will be tantamount to sending our foot soldiers to the front line unarmed. That is a recipe for defeat. While at the time of the attainment of our independence in 1990, Namibia could only train a handful of nurses locally, and there was no medical school, with progressive investments, capacity to train health professionals locally has been enhanced. The University of Namibia School of Medicine was established in 2010 and has trained over 400 medical doctors. Many of the alumni of our medical school are serving our country in different capacities, including in our public sector. Today, Namibia is one of the countries with a relatively high density of health workers in Africa. We have an estimated 5.43 medical doctors and 33.52 nurses. I don't know how that works out. Per every 10,000 people. However, the vast geography and low population density negatively affects service delivery dynamics. It means that health facilities must be established in different parts of the country, even in areas where the population numbers are significantly low. This leads to staff shortages, as health care workers must be widely deployed. The impact of this reality on the quality of health care is negative. In 2019, Namibia undertook a comprehensive human resources for health situation analysis and developed a 10-year human resource strategic plan covering the period 2020 to 2030. As part of its implementation, the staff establishment of the Ministry of Health and Social Services was reviewed to ensure that the structure is adequate and responsive to address the disease burden in the country. With investments in the health sector through the collective effort of government, the private sector, and our development cooperation partners, we are witnessing tangible progress in improving health outcomes. The country stands favorably in comparison to regional benchmarks. In 2022, Namibia recorded a neonatal mortality rate of 19 and an under 5 mortality rate of 39 per 1,000 live births, compared to the regional figures of 63 and 95 respectively. While strides have been made, substantial work lies ahead. We are determined to reduce the maternal mortality rate of 215 deaths per 100,000 live births. We are working with our stakeholders to tackle and overcome these challenges. Co-Director of Proceedings, ladies and gentlemen, Africa must turn the tide of having just 4% of the global health workforce and 23% of the disease burden. The investment in the health workforce must aim to change this balance. It is for this reason that we look forward to the launch of the Forward-Looking Africa Health Workforce Investment Charter, to be launched in the course of this meeting. This bold initiative will serve to harmonize and amplify collective efforts towards investing in a robust and effective Africa health workforce. Amongst other things, the Charter aims to cut Africa's health workforce shortage in half by 2030. This will be achieved by aligning and stimulating sustainable long-term investments in the health workforce across the region to reduce inequalities in access to health workers, especially in rural and underserved areas and in primary health care settings. It will also promote the creation of decent jobs and the economic empowerment of women and youth. There is no doubt that investing in the health workforce can have positive spin-offs in the form of decent jobs, particularly for women and youth who often face barriers to employment. By providing opportunities for education, training, and career progression, the Charter will immensely contribute to the economic empowerment of these demographics and fundamentally support inclusive economic growth. Co-Directors of Ceremonies, our country is honored to host the Ministers of Health alongside their counterparts from education and labor ministry stakeholders and other decision makers. I don't see the Ministers of Education from Namibia. Are they here? And the Minister of Labor. The high-level roundtable dialogues examining our collective progress over the last decade and the emerging challenges being faced are important platforms that will guide actions aimed at achieving the SDGs. I call on my fellow African leaders to continue making the impactful decisions necessary for the growth and prosperity of our continent. At the same time, I urge all countries, partners and stakeholders to work together in solidarity to make sustainable investments in a robust and effective African health workforce. Let us work together and find innovative and smarter ways to invest in our health workforce. And I agree with the Director General of CDC Africa in what he said in regard to the need for Africa to develop its own internal capacity to address diseases on the continent instead of relying on others. It is now my honor to declare the inaugural Africa Health Workforce Investment Forum here in Windhoek officially open. I thank you.
And we thank you, the Right Honourable Prime Minister of the Republic of Namibia, Dr. Sarah Gumbewa-Madila, for officially opening this investment forum. And now, ladies and gentlemen, we need to, as with all of these events, take a photograph, because these days they say if you've not photographed the event didn't happen. So, because of that, I need to ask the high table, please to rise. The photographers, are you happy with how it is? We'll do this one first. We do a couple of house official photographs. Then we'll do part 2, and then we'll do another official photograph. Oh, my co-director is here.
Yeah, the co-director is here. For the sake of time, we will proceed to part 2, and then there will be 2 stations where the photographs will be taken in terms of branding for the investment forum and for the certification event. So we will proceed to part 2 for now, and then we'll do that later. Ladies and gentlemen, can you give Mehilda Namjebo another round of applause for directing the program so ably this morning? Thank you very much. We are moving to the second segment of our program this morning, and as I indicated in my welcoming remarks, we have a double-barreled program. What we witnessed and concluded now was the segment dealing with the inaugural Africa Healthcare Workforce Investment Forum that we successfully concluded. Let us give ourselves a round of applause for having concluded that segment. Thank you very much. So now we are moving on to the second segment, which deals with the awards being conferred on Namibia for being on the path towards elimination of mother-to-child transmission of HIV and the hepatitis B virus. This is going to be a short one. We have 3 speakers. The regional director for WHO will come to the podium and make an announcement. There will be a video from the WHO Director General, Dr. Tedros. There will be remarks by the Honorable Minister of Health and Social Services, and then the acceptance statement by the Right Honorable Prime Minister, Dr. Sarah Gumbewa-Madila. Now, our speakers have been introduced. When my co-director introduced Dr. Mweti, there was something that you didn't mention, and I wanted to mention it. And this is not based on ChatGTP. I used other sources. Dr. Mweti is the first woman to be elected as regional director for WHO Africa. So that's a historical. And she has been leading this entity for a number of years. Since 2015, she has led the transformation of WHO in Africa to ensure that the organization is accountable, that it is effective, and that it's driven by results. A key feature of her leadership is the cultivation of strong partnerships, both with traditional and new partners, including philanthropic foundations, civil society, academia, and increased engagement with young people and women in matters of health. So we have a champion amongst us, and it's a pleasure for me to ask you to put your heads together and to welcome Dr. Mweti to the podium. Dr. Mweti,
Thank you very much, Executive Director. Right Honorable Prime Minister Sarah Kukongwela Amadila, the Prime Minister of the Republic of Namibia, my brother Dr. Shangula, the Honorable Minister of Health, Honorable Ministers, Ambassadors, my brother of the Africa CDC, John Kaseya, dear guests, colleagues, and friends, all protocols observed. I greet you once again. And it's a great honor for me to participate in this very special event to celebrate a key achievement in Namibia. I've been to this country several times, but I have to say today feels like my first time, perhaps because this feeling is linked to the pride and the smiles that I'm sure will come to your faces, all of us, due to this milestone. Honorable Prime Minister, I congratulate you, your government, and the people of Namibia for achieving, first, the bronze tier on the path to eliminating mother-to-child transmission of HIV. Second, the silver tier on the path to eliminating mother-to-child transmission of hepatitis B virus. Namibia is the first country in the world to be certified silver tier in eliminating hepatitis B virus. So that is phenomenal. And let's give the Honorable Prime Minister, Honorable Minister of Health, your team in the ministry, and the people of Namibia, including particularly the health workers in Namibia, another round of applause. The strong leadership of the government, the commitment of the Ministry of Health, the dedication of the National Validation Committee, and the devotion of the frontline health workers have all contributed to this achievement. This attainment is significant because it advances health for women and children and shines as an example to other countries in our region. It demonstrates that eliminating mother-to-child transmission is possible. And I say that with particular pleasure because I've come from a neighboring country whose HIV prevalence has quite matched Namibia's during this pandemic. This accomplishment also demonstrates the growing importance of partnerships and collaboration for health. And I'd like to stress again that Namibia's success came from its overall progress in the HIV and the hepatitis response. In this journey, under the leadership of the government, we in the WHO African region joined forces with UNAIDS, with UNICEF, with PEPFAR, with implementing partners, with civil society organizations, with communities, and with networks of people living with HIV and hepatitis, especially women. Our cooperation was a driving force in reaching this milestone. As WHO, we will not relent in pursuing our commitment to the triple elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B virus. Namibia's certification on the path to elimination required rigorous assessments of fundamental requirements, namely data quality, strong programs, laboratory quality, human rights, and gender equality, and community engagement. I'd like to encourage Namibia, please continue this work and maintain and improve the current achievement level. As WHO, we offer our continuing support to facilitate Namibia's progression to the gold tier for hepatitis B and HIV, as well as towards the targets for syphilis. To eliminate mother-to-child transmission of HIV and hepatitis B on the continent, prevention, care, and treatment interventions must be part of standard antenatal care in all high-burden countries. So I urge and encourage other countries in our region to emulate Namibia's path to elimination and consider undertaking the validation process. I assure them of our availability to provide the needed support. I'm now going to give the opportunity for us to hear a message from our Director General, Dr. Tedros, before, on behalf of WHO and all the partners, I hand over the certification to the Honorable Prime Minister. So we'll pause for that message from them. There he is. DG, you're welcome.
Honorable Minister Dr. Kalumbi Shangula, dear colleagues and friends, I congratulate Namibia on achieving the silver tier on the path to elimination of mother-to-child transmission of hepatitis B and the bronze tier on the path to elimination of mother-to-child transmission of HIV. Since 2015, 19 countries have been validated for achieving elimination of vertical transmission of HIV or syphilis. However, high levels of maternal HIV and syphilis in sub-Saharan Africa make it extremely difficult to reach elimination even with strong programs. That's why we recognize progress on the path to elimination through certification at bronze, silver, or gold levels. I commend Namibia's government, health workers, and civil society organizations for your impressive progress in preventing mother-to-child transmission. And I congratulate you for being the first country to apply for certification for being on the path to triple elimination of mother-to-child elimination of HIV, hepatitis B, and syphilis. Namibia is a pathfinder country for other countries in the region and around the world to follow. You have demonstrated that even in the face of many challenges, real change is possible. A healthier world for all is possible. I thank you.
Yes, Dr. Shangula, please join the Prime Minister as the handover takes place. And then Dr. Kasea also will join. Yeah, so please take photos, media, let us record it right there.
you very much. Can I be assisted with the certificate, please? Where is my assistant? Thank you very much. Thank you. With that handover, we will invite Dr. Shangula, as Minister of Health and Social Services in the country, to make a few remarks, which will be followed by a statement by the Right Honorable Prime Minister. Dr. Shangula is already starting, is already standing. I just want to mention that in addition to the other credentials, Dr. Shangula is also an author. He has written a book called Journey into the Unknown. So if you visit the bookshops, please get yourselves a copy. But I don't want to say more because it's already standing, other than to say, please put your hands together and welcome Dr. Shangula to the podium.
Thank you very much, Director of Program. Before I go ahead, I want to assure the House that this is the last time I will be standing here before lunch. Right Honorable Prime Minister, members of the High Table, allow me to stand on the salutation I made earlier in the interest of time. I would like to take you briefly through the journey we traveled, which brought us to this stage. But before that, I want to thank the Director of Proceedings for awarding me this opportunity to speak. Namibia has been implementing a program for the prevention of mother-to-child transmission of HIV since 2020. In actual fact, this program was the first intervention program in Namibia we have instituted. The first programs entail advocacy, awareness raising, but this was the first program in which we use medication to mitigate the effect of HIV. The program for the prevention of mother-to-child transmission is integrated into maternal and child health service delivery settings, namely antenatal care, labor, delivery, postnatal care services. It's an integral part of this. And this program is fully funded by the government and is available in the public sector for all at no cost to the clients. Namibia has made significant progress in this regard. Their children and their families. On the 16th of February 2024, the Minister of Health and Social Services received a notification from Dr. Tedros Ghebreyesus, the Director General of the WHO, informing Namibia of the outcome of Namibians' assessment of mother-to-child transmission of HIV and hepatitis B virus, conducted by the World Health Organization Global Validation Advisory Committee in 2023. We heard the Director General speaking himself. The communications informed that Namibia has been certified by WHO as having achieved the silver tier on the path to elimination of mother-to-child transmission of hepatitis B virus, and the bronze tier on the path to elimination of mother-to-child transmission of HIV in 2020 and 2021 respectively. For a country with a high HIV and hepatitis virus burden, to be recognized to be on the path to elimination of mother-to-child transmission of these diseases is indeed a significant achievement. We are encouraged that Namibia's investment in health, particularly in prevention of mother-to-child transmission of infectious diseases such as HIV and hepatitis B, is paying off and is bearing fruits. These achievements came after many years of investments to offer free services and deliberate yet consistent actions in the prevention of mother-to-child transmission of HIV programs. This includes provider-initiated HIV testing and counseling, which is integrated in all care settings, free testing and treatment for hepatitis B and syphilis, free antiretroviral therapy to mothers and partners, provision of free antiretroviral prophylaxis to all HIV-exposed infants, testing for early infant diagnosis of HIV, and pre-exposure prophylaxis for HIV-negative mothers to reduce the risk of contracting HIV while pregnant and during the breastfeeding period. Public health facilities also provide preconception counseling for HIV-positive women and men who are planning to conceive to do so safely. These services have been decentralized to rural clinics, outreach points, and community-based ART sites to increase access. We have trained community health care workers to ensure service availability and quality. The deployed community health workers are trained and conduct follow-up mother-baby pairs at the community level until babies graduate from the PMTC program when they are declared HIV negative and no longer being breastfed. We have established a national validation committee with multi-sectoral membership under the leadership of the Ministry of Health and Social Services. Despite the COVID-19 situation between 2020 and 2022, the country continued to ensure that prevention of mother-to-child transmission services and the gains made towards the elimination of mother-to-child transmission were protected, namely through the establishment of the COVID-19 continuation of essential health service pillar. This response pillar focused on ensuring that other essential health services are not interrupted during the response to the COVID-19 pandemic. Between 2022 and 2023, the Ministry of Health and Social Services, in collaboration with the National Validation Committee and partners, conducted a national validation assessment for 2020 and 2021 in a consultative manner in line with WHO established guidance. The National Validation Assessment Report formed the basis for Namibia's applications submitted to WHO on the 30th of June 2023. Following the application submission, a group of experts from the WHO team, known as Regional Validation Committee, came to Namibia and independently picked random facilities and interviewed beneficiaries and providers to validate the information contained in the report submitted by the Ministry in June 2023. The Regional Validation Committee then compiled the report, which was submitted to the World Health Organization Global Validation Advisory Committee in Geneva. The WHO Global Validation Advisory Committee assessed Namibia's submission on the 29th of November 2023. Although Namibia applied for triple elimination, including HIV, hepatitis B, and syphilis, due to some data gap on syphilis, this was precluded from the path to elimination validation exercise by WHO Global Validation Advisory Committee. We are working to improve this data set for the future. Namibia's achievement of bronze tier for the elimination of mother-to-child transmission of HIV. The overall mother-to-child transmission rate of HIV was 4.02% in 2020 and 4.41% in 2021. This translated to a mother-to-child transmission case rate of 603 per 100,000 live births in 2022 and 594 in 2021. Over the 2 years, Namibia obtained almost 100% of HIV testing among pregnant women attending antenatal care, 99.7% in 2020 and 99.5% in 2021. The antiretroviral therapy coverage among HIV-positive pregnant women was 98.4% in 2020 and 98.4% in 2021. The next path to elimination validation assessment will be done again in 2026 and will focus on the period from 2022 onwards. Considering that elimination of mother-to-child transmission journey is a continuous process, the validation process acted as a lens for identifying existing bottlenecks which the country need to address in order to achieve and sustain elimination of mother-to-child transmission targets in 2026 and beyond. The government, through the Ministry of Health and Social Services, will continue to strategically engage with development partners, non-governmental organizations, and the private sector to ensure equitable access to high-quality elimination of mother-to-child transmission services at all levels. In February 2023, Namibia received an award from Ambassador John Kengasong of the U.S. Global AIDS Coordinator and Special Representative for Health Diplomacy for achievement made with respect to 95 UNA fast-track targets towards ending AIDS as a public health threat. Namibia achieved 94, 97, 95. This is another indication of the progress we're making in the overall HIV/AIDS response. I take this opportunity to express my appreciation to our government for the demonstrated political will to respond to and mitigate the impact of HIV/AIDS. We are also grateful for the support from development, implementing partners, and multilateral organizations, both financial and technical support. Community and traditional leaders, beneficiaries, and the community at large are important pillars in the response. So too are the healthcare workers at the facility and community level. We thank various media houses who continue to share and spread information and messages on HIV prevention, treatment, and care of pregnant women and their babies, which has led to the result we are celebrating today. We are convinced that together we can end HIV/AIDS as a public health threat by the year 2030. I thank you.
Thank you, Dr. Shangula. Another round of applause for him. We thank him for taking us down memory lane in terms of where we come from to reach this important national milestone and sharing with us what needs to be done. We need to move towards the triple elimination of mother-to-child transmission of HIV, hepatitis B virus, and syphilis. As he indicated, we are working hard on the syphilis matter, and hopefully we'll again go back to WHO to apply for the elimination of that particular disease. Our Right Honourable Prime Minister has already been introduced by the Honourable Minister, and let me just take this opportunity to request you, ladies and gentlemen, again to put your hands together and rise to welcome Dr. Sarah Bugongera Madira to the podium to deliver the acceptance statement.
Thank you very much. Please take your seats. I stand on the protocol that is established already. Good morning once more. I stand before you with immense gratitude and humility as we celebrate a monumental achievement for Namibia's public health care system, specifically with respect to our national HIV/AIDS response. It is with great honor that I, on behalf of our President, Dr. Nangolo Ngumba, receive this prestigious recognition from the World Health Organization, marking Namibia's achievement of the silver tier on the path to elimination of mother-to-child transmission of hepatitis B virus and the bronze tier on the path to elimination of mother-to-child transmission of HIV/AIDS. This recognition is an important milestone in Namibia's march towards ending HIV/AIDS as a public health threat. We are indeed encouraged by the fact that Namibia is the first country in the world to be assessed and recognized to be on the path to elimination of mother-to-child transmission of the hepatitis B virus, and also that we are the second country in Africa to be recognized to be on the path to elimination of mother-to-child transmission of HIV/AIDS, following in the footpath of our neighbor, the Republic of Botswana. And I was saying to Dr. Moeti that Botswana and Namibia had some of the highest infection rates of HIV/AIDS. When we first got our independence in 1990, we were actually leading, and we were inspired to see Botswana overcome almost this challenge by leading the way, and we were inspired by that to follow in their footsteps. This recognition, however, does not only speak to the important work that is done by the government of Namibia in this subsector of public health and the healthcare professionals who have dedicated their lives to this cause, but it is also a testament to the resilience, the unity, and unwavering commitment of the Namibian people as a whole, and the immense support that we have received from our development cooperation partners over the years. It is a testament to the strength of the countless mothers, fathers, and children who have been impacted by these diseases and who have stood with fortitude in the fight for a healthier future. The prevention of mother-to-child transmission and immunization programs in Namibia are fully integrated into the maternal and child health service delivery settings at health facilities and community levels. Over the years, the country has made significant strides improving the PMTCT indicators. PMTC services were rolled out to 99% of all health public facilities by 2019, as we have heard. And Namibia has been implementing evidence-based interventions in line with international and national standards, including recommendations from WHO through development of operational guidelines, training of health workers, recruitment of key staff, capacity building of laboratory services, support for community-based interventions, development of health infrastructure, as well as procurement of equipment, ARVs, vaccines, and clinical supplies. In 2020, Namibia launched the National Roadmap for the Elimination of Mother-to-Child Transmission of HIV and Congenital Syphilis that covers the period 2020 to 2024. The plan set the goal and milestones for the country to be certified as having achieved one of the tiers according to the targets of WHO's Path to Elimination, PTE. An addendum to the elimination of hepatitis B virus, HBV, was made in 2023. In addition, the national roadmap outlined strategies and activities to ensure the provision of quality PMTCT services, laboratory services, data collection, as well as greater and meaningful engagement with networks of civil society groups and beneficiaries of these programs and interventions. The work done by the Ministry of Health and Social Services and the National Validation Committee in collaboration with WHO-led regional and global validation committees to assess our HIV and hepatitis B virus programs for the years 2020, 2021, and 2022 showed that almost all pregnant women in the country attended at least one ANC antenatal care visit. Over 90% deliver in health facilities. And HIV testing amongst pregnant women was 99.9% in 2020, 99.5% in 2021, and 99.7% in 2022. Antiretroviral therapy, ART coverage amongst HIV-positive pregnant women stood at 98% in 2020, 2021, and 2022. More than 98% of babies born to HIV-positive mothers are born HIV negative, as we have heard from Dr. Shangula. Namibia offers hepatitis B virus testing to all pregnant women receiving ANC services. Testing for hepatitis B virus amongst pregnant women was 89% in 2020, 92% in 2021, and 93% in 2022. Coverage of hepatitis B vaccine birth dose was 86% in 2020, 83% in 21, and 94% in 22. The coverage of hepatitis B vaccine third dose amongst children was 93% in 2020, 94% in 2021, and 84% in 2022. Ladies and gentlemen, our success in achieving these goals is the result of a comprehensive and holistic approach to healthcare. It is the result of investing in prevention, testing, treatment, and support services for mothers and their newborns. It is the result of investing in the laboratory services. It is the result of prioritizing education, awareness, and community engagement to break down stigma and discrimination, as well as respecting human rights. It is the result of efforts towards building robust monitoring and evaluation systems. And it is the result of forging partnerships and collaborations with development and implementing partners who have been invaluable allies in our shared mission. Eliminating mother-to-child transmission of HIV and HBV is not just a public health goal, it is a moral imperative. Every child born free from these diseases represents a triumph of compassion over adversity, of hope over despair. It represents the fulfillment of our promise to future generations, a promise of a world where every child has the opportunity to thrive, regardless of the circumstances of their birth, a step towards ensuring an HIV-free generation. But while we celebrate these milestones today, we must also recognize that our work is far from over. The fight against HIV and HBV is ongoing, and there are still many challenges that lie ahead. We must remain resolute in our efforts to expand access to healthcare services, particularly in rural areas and underserved communities. We must continue to invest in research and innovation to develop new and more effective treatments, and we must redouble our efforts to address the underlying social and economic determinants of health that perpetuate health disparities and inequalities. As we look to the future, let us draw inspiration from the progress we have made and let it fuel our determination to do more. Let us commit ourselves anew to the cause of health equity and justice for all. And let us never forget that the true measure of our success lies not in the awards we receive, but in the lives we touch and the difference we make in the world. At this particular moment, let me once again thank the World Health Organization for this honor, and thank you, the people of Namibia, for your courage, your resilience, and your unwavering commitment to building a healthier, brighter future for all. Furthermore, I would like to thank our development and implementing partners for technical and financial support provided to us. Together, we have the power to shape a future where every child is born free from the burden of HIV and HBV, a future where health equity is not just a dream, but a reality for all. I thank you.
Thank you very much, Right Honourable Prime Minister, for those words. I just think to our audience how fitting it is that this reward to Namibia is presented during this specific week. It is not only the commemoration or observance of International Nurses Day, which Namibia will celebrate on the 8th of May, but it's also the birthday we celebrate of our founding father on the 12th of May. Our founding father is expected to turn 95. So for Namibia, it's a big week celebrating a giant for us in terms of the history of this republic. But then also on Sunday, it is Mother's Day. So really thrilling that this award comes to us at such an opportune time like this. Now we're going to do this photo. Are we together, Edie?
I think we will do everything else and then go to the photo and then everything else follows.
In your hands.
Okay. Well, thank you very much once again. The Right Honourable Prime Minister, in her remarks, I think made two poignant points. That elimination is a moral imperative. I think that is very, very powerful. In that when we talk about elimination, it shouldn't be the awards that we receive, but the lives that we touch. Again, that reminds us of the importance of the work that we do, particularly in the public health space. So thank you very much, Right Honourable Prime Minister, for expressing these points so eloquently. Now we are moving towards the conclusion of our program. In fact, we are done with all the formal statements. What is going to follow is announcements in terms of what is going to happen for lunch arrangements, the photo opportunity, etc. And then we will do the national anthem and go for the photo opportunity. So, Ms. Ikosa, the operations officer for WHO country office, will come and make those announcements. We will then sing the AU and the national anthem. We will go for the photo opportunity, and then I think basically proceed to lunch. Ms. Ikosa, can you come to the podium? Okay. So if I understand we'll be guided in terms of how lunch is going to take place, can I just get an idea, where is it going to be so that everybody is aware? On the other side of the restaurant. Okay. So with that, therefore, let me kindly request all of you to rise for the AU and the national anthem.